right, so I suggest we start. Welcome everyone. Thanks for joining us today for this session about unlocking patient engagement intelligence, where we're going to learn from our Made with Patient awardees and help define what makes a winner. My name is Emily Luciani. I am a program director with the Synergist, and I support the patient-focused medicine development, PFMD. Today we are going to first, of course, set the scene with a few introductions and also a few words about the impact of the Made with Patient Awards. But then very rapidly, we will move into breakout rooms to allow our participants to meet the awardees of the 2025 editions, and then to co-create with us the potentially the next edition, because indeed our goals for today are to learn directly from the award winners about their work in patient engagement and their journey in that work, but also to seek from all the participants in this call inputs about the selection criteria for the next edition. Just a couple of housekeeping rules before we get started. I would like to ask everybody to please be present and engaged. As much as you can, turn on your video. It's always nice to see the faces of the people we talk to. Keep your microphones in mute when you're not talking, and please don't hesitate to provide your questions, comments, and feedback in the chat. The session is recorded, so for those of you who might be listening to that as a recording session, welcome as well. And hopefully we'll make this workshop interesting together. For those who might need translation, we have an AI translation tool that has been activated, and you can select your language for the translation. When we go to breakout rooms, you can also activate the subtitles if you need translation. But let me introduce today's speakers and moderators. So first of all, I want to say thank you for all our champions and initiative award winners. All of you have accepted to be with us today, the 9 awardees. So it's really a pleasure, and thank you for your time sharing your experience. I will not introduce you right now because I want to give you the floor later to do that properly. But thanks, Bahija, Lara, Mwape, Emma, Zoe, John, Atta, Isabel, and team. We're gonna hear from all of you very soon. And also to help me and my colleagues with the moderation today, we're very lucky to have our jury co-chairs, Lode and Paula, as well as 2 of our amazing jury members, Abigail and Rose. Thank you so much for being with us today. So I would like to ask you now, all the participants, to take a quick poll and asking you what you are looking for the most in this session. Because we're going to do all of these things. We're going to learn more from the Made with Patient Awards, discover inspiring examples, gain insights to prepare a submission for those of you who might be interested in doing that, and get ideas and, of course, inspiration for enhancing or starting patient engagement. So please take this poll that my colleague is now sharing. I'm gonna give you a few seconds to do that. And please feel free to select multiple choices. I am hoping that by now you all had a chance to select your answer. So I'm gonna ask my colleague Matt, maybe to give us the results. All right. Okay. Oh, this is great. I'm glad that the vast majority of you want to discover inspiring patient engagement examples. This is exactly why we are here for, and obviously doing all the rest at the same time. So we will all together hopefully be able to cover all of this. All right, so maybe a few words for those of you who might be less familiar with the Made with Patient Awards. PFMD, the Patient Focused Medicine Development, our ambition is to facilitate the adoption of patient engagement by everyone in healthcare worldwide and to really be able to scale and deepen patient engagement. So, with that, the Made with Patient Awards is one of the projects, one of the initiatives that we have to achieve this ambition, as it allows to collect and to select the best practices of patient engagement work in practice. And then it helps making those initiatives that work widely disseminated and easily accessible to hopefully serve as a blueprint for excellence in patient engagement. And our ambition is also that receiving an award makes a significant contribution to the awardees' recognition and work. So this is what the Made with Patient Awards is about. Last edition in Baveno in June, we celebrated the 9 awardees who are online today. And today we want to go one step further and go really into disseminating this work and co-creating excellence in patient engagement. Obviously, all of that could not have been possible without the work of our jury members. We have this year 11 amazing jury members who worked tirelessly. You can see on the screen who they are. And as I said earlier, we're lucky that some of them were able to join us today. And we have Paula and Lode, our co-chairs, as well as Abigail and Rose here today with us. And I will give them the floor shortly. But I also want to remind you all who were our awardees this year. So we had 5 initiatives who won the award: Eczema Wise, Kidney Essential, Lupus GPT, the Elimination of Hepatitis Initiative in Pakistan, and Parkinson's UK Tech Guide. We will carefully listen to what they've done in a few minutes. But thank you again for being online. And we also have our 4 awarded champions online. Hall of Fame champions, Lara Bloom and Bahija Gohimi, and the rising stars, Mwape Chisonde and Emma Doble. My last remark before I give the floor to our co-chairs. I said earlier that one of our ambitions is to make a difference for the awardees by giving them the award. And so I'd like to briefly share 2 examples of how this is happening. On this slide, you see Rancy and Marco. Rancy from Project Pink Blue got invited to the face-to-face PEOF event in 2024 to receive his Rising Star Award. This offered him a great networking opportunity because at PEOF he met someone from the Global Colon Cancer Association, and their encounter led to Project Pink Blue receiving the Colorectal Cancer Health Equity Grant that allowed the organization to develop a documentary that is called Blood in My Stall, which premiered at PEOF 2025. So a year later, this documentary had been created and was screened at PEOF, thanks to this encounter. Another rising star awardee of 2024 was Marco from the European Patient Liver Organization. And he shared how this he's getting the award became a turning point for his organization because it made their work more visible and therefore created an opportunity for ELPA to initiate a work with researchers from Pavia University. And in those conversations, they realized that while liver disease presents a substantial global health burden, there is still a lack of structured frameworks and publications focused on liver patient engagement and advocacy. So they decided to create and co-create meaningful tools for the liver community that could serve as a model to also for the other disease communities worldwide. So this work is ongoing, and in addition, the recognition of Marco as a rising star in fact led to several nominations by the member associations of his umbrella patient organization, meaning that ultimately his award has been a great and inspiring impact for the liver patients community. So these are two examples I wanted to share with you all. And now I will leave the floor to Paula and Lode to introduce themselves and share their perspective about the intelligence they collected as jury co-chair for the past years. Over to you.
Thank you so much, Emily. So I'm Paula Wray. I'm based at the University of Oxford, and I have been fortunate enough to have been on the journey as a sort of a jury member, now co-chair, but right from the very beginning with the Book of Good Practice with Patients-Focused Medicines Development. And you'll hear us say we have an awful lot, as you can see from the infographic. The numbers that we get year on year are increasing dramatically, but also the volume that we're getting provided with each of those numbers is increasing. But I just wanted to add in additional work about Marco. The reason I come back and want to do this year on year is I get amazing information about all these initiatives, these champions, and what I've been able to do is link past awardees, Devices for Dignity and Marco into big European grants where they're not focusing on liver disease or musculoskeletal conditions, but it's actually about the networks that those individuals bring that I would not be aware of if it wasn't for these awards and this process. So I feel incredibly privileged, but I love the fact that there are all these new collaborations and partnerships that are coming out of this, because even the awardees coming together, the nominees having awareness through the jury members. And what we wanted to do with this session was to help share that knowledge so that other partnerships and collaborations can come together. And as you can see, the geography is expanding as well, a lot more from Asia and Africa, which is fantastic. So we're now getting nominations from across every continent in the globe. And it's raising awareness, but it's also helping us understand how PFND can support these burgeoning initiatives and individuals. But the big thing from the jury member perspective is the quality has improved massively, which makes our job really difficult. Initially, we could score based on the quality criteria. And the last few years, everything's scoring across the board at the highest score. So then we have to have more intricacy in how we make a decision on things that are so different. And so this year was the first year we introduced the quality criteria scorecard. And I will now pass over to Lode to share his experiences of that and some other learnings from this. Thank you very much. Oh, Lode, you're on mute. Sorry.
Thank you, Paula. As always, I can rely on Paula. So my name is Lode. I'm the co-chair. I've been so for several years with Paula. And in fact, we tried to kind of announce our resignation on stage last year, but then there have been some important changes at PFMD in that we have a new executive director and also a new program leader for the Made with Patients Award. And they asked us to stay on for another year. So I'm sorry, you're stuck with us. back to the discussion. So as Paula already mentioned, the volume's up, the geography is up, and so is the quality. We really see a huge increase in quality, which we are still trying to get our hands around. But there's also some issues that we see coming back, and that since this is a learning session, we want to feed back to you. So let's look at the first on the left first. This applies to both initiatives as well as champions. So nominations for projects as well as for people. We still see a huge confusion between advocacy and engagement. And let's be clear, this is a recognition for patient engagement initiatives and patient engagement champions. The easiest way to understand the difference, because we do know that these words are sometimes used and mixed and all of that, is that advocacy is more the intent. It's like when you advocate for a cause, whether that's a social cause or what have you, an injustice, you advocate for something or somebody. That person is not necessarily present or involved. That's purely what advocacy is. And we see a lot of advocacy, fantastic advocacy. But what we are looking for is engagement, which is the second, which goes a step further. It actually asks to work with the people that you're advocating for, right? Which is why you automatically also get the for the people, because you can't work with people against the people. And so engagement is focused on the how, and it's also like an engagement ring. It's a longer term duration. Now, just for completeness, there's a third term that we see a lot, which is involvement. And that just describes the fact that something is done with somebody else. It does not say how it's done. It also doesn't say that it's a long term. But so to be clear, this is a big confusion that we still see. And sometimes people just say, oh, she's such a fantastic advocate. She's talked so much for so many years. We respect that. We love that. But that's not what we are looking for in the patient engagement awards, okay? So that's the left side. On the right side is the second biggest source of confusion. We get a lot of ideas that are absolutely fantastic, but that are actually submitted a bit too early. In fact, that there is no outcome yet. There's no result yet, and let alone there's an impact. So what we try to do with the jury is we use these criteria on top of quality, because now that the quality has gone so up, remember the quality is the how it is done, right? But it could be extremely small scales. So what we look for is also the impact. And the four things that I mentioned below is, for example, can this be scaled? Can this become bigger, rolled out? Could it be reproduced in another country or replicated in another disease? Those are things that really tip the balance towards the winners. So the general transferability, can we, through sessions like these, take this ID and apply it somewhere else? You don't have to be de novo and start from scratch. Take a good idea and apply it somewhere else. So beyond quality, we really look for these additional dimensions to really find the winners, because I can tell you, and this makes the jury work so difficult, when we get to our third round, everybody has a fantastic quality. Absolute, and it is really, really, really hard, because the quality criteria and scales no longer differentiate. And that's when we bring these other things. So please, what do I mean with that? Include it in your submission, but also if you've done a submission and you were not yet picked as a winner, maybe it was because those dimensions were not yet there. It just had may been too soon. The most frequent comment from the jury is, oh, we'd love to see this again in 2 years when there's actual results. All right, that's the key issues that we see. And now I'll hand it over to Roz, who I'd like to introduce to you also as a future co-chair, because Roz has agreed to on board with Paula and me, and there will be a second one, so that she can actually roll into this job and next year take it over. So Roz, over to you. Thank you.
Thank you so much, and it's an honor and a privilege to do that, and to serve on the jury. And this summary, I'll echo some of what you've already heard, that the volume was up, but that's not enough. That what stood out for me was the representativeness and the diversity of the initiatives, not just in the types of projects, but in the communities that they represented and that they serve. It was, I would say, a powerful reflection of the global network that PEOF and its partners have cultivated over the years. And it highlights just how much is still needed to advance healthcare as a right and not as a privilege. The scoring, as Lode has said, was really hard. The scoring of the initiatives for their quality, because each one conveyed that weight of the lived experience and the expertise that lives in the community, that promise of impact, and focus on collaboration and co-creation. Again, what we were looking for was that with patients, not instead of, but in addition to for patients as that critical distinction. And the champions, without question, were each heroes, completely selfless in their dedication, tireless in their advocacy. But more than that, what we see in the awarded champions was that innovation in what they were doing and how they were doing it, how they were getting into and collaborating and reshaping the systems around them that have within them structural injustices, but they're working still within those very imperfect systems. So our discussions on the jury were very rich. They were grounded in our shared values, but they were shaped by our varied, I would say, cultural, professional, personal, and geographic lenses. And I think that helps us to do a better job. I will say the entire experience has been humbling and energizing. And let me turn it over to Abigail Simon Hart, my fellow jury member, to comment as well.
Thank you very much. I was just hoping that you stop talking so I have something to say. But no, it's I'm one of the newbies, and I must confess, when they said there's a lot of work, I thought, how much work can it be? And there is a lot of work. But it was really enriching. It was so exciting to see the geography and the spread compared to when I won the award a year ago. I was so excited to see there was much more input from low and middle income countries, which is where I come from. So I was really encouraged that there was a lot of traction in low and middle income countries. And that just really tells you about the diversity that you find in PEOF. And I think that's what makes it exciting, is that where you come from doesn't mean you cannot win an award. And I think that was what really I found encouraging. And the amount of applications that we got was phenomenal. One of the things I found a bit challenging was that some people didn't quite give enough information. So we had to go and check online. We had to check LinkedIn and things like that. So there was, for some people, you could see it was fantastic, but there was a lot of background work that needed to be done so that we did an all-round thing. So that was one of the observations. But like I said, it was amazing. Like everybody has said, by the time we got to the final set, it was really down to almost coming to blows who is going to be selected, because there were just too many. I mean, in our opinion, everybody really is a winner, but sadly there's a limit to how many awards we can give. So I think it's getting more and more difficult to pick and choose, and that just shows you that the quality is increasing and improving with every year. So and we're just hoping that during the co-creation event, which we'll have later, you can help us to define what you would like to see, what in your opinion comes to a winner, so we can make sure that we're covering all the stops. Nobody has a monopoly over information or what makes a good winner. And that's why sessions like this is so important, that everybody really has a say in how do we make this bigger and better and more effective, and how do we even support people after they've got the awards as well. So I'm super excited, really gingered up, looking forward to another year, and like I said, bring it on.
Thank you so much. And Abigail, you're right. Everybody is a winner, and our finalists are also winners in that sense, as their work has been really recognized. So